We have a program that is specializing in people who have rare cancers.
Dr. Dale Shepard is a Cleveland Clinic oncologist.
Rare cancers we're defining as 1 or 2 cases per every 100,000 people in a year. So I think one of the scariest things usually for people when they have a rare cancer is that they get a sense of it's different than what they've heard about. They don't know really what to do with it. They don't know what options are available. They talk to their friends and family and they have likely never heard of it either. And so one of the biggest things we can do is provide them useful information and treatment options. And so within our program we have medical oncology, we have surgery, and we have radiation oncology, we have pathology. One of the very important things with rare cancers is to actually make sure that it's a proper diagnosis. They may have been somewhere where the pathologist just isn't used to seeing them, and so one of the first things we like to do is just make sure that they even have the right diagnosis.
Patients come from all over to be part of the Rare Cancers program.
They come a distance, oftentimes, to get information. Oftentimes from the medical oncology standpoint, I can offer suggestions on treatment, and then they can go home and get the chemo, maybe come back if they have further questions or things worsen and we need another treatment plan. But people travel a distance really just to get that information they need. We actually have a website that sort of highlights a lot of the tumors that we are specializing in on a rare tumor standpoint. We've really been careful to select some tumors that we know that we have expertise in, that we have medical oncology that has seen it and sort of knows what to do with it, that maybe we have surgeons that can specialize in that we have radiation oncology sort of techniques that can do that. And so they find us through our website, they find us through social media. So we've actually had a number of people who come through Facebook groups, come through foundations. It's really important that people with rare diseases get a second opinion. They have to be comfortable with the plan. And that second opinion can take a couple of different things. It could be that they come and see a specialist that specializes in that particular disease. Or the other thing we encourage is, if there's physicians out there that have questions, call us. We're happy to work with them. If it helps the patients, it's a good thing. Call us up, I have a patient, what do you think? So it's really important. It's really important people use social media in a wise sort of way. Go to reputable sites. It's really important that people go to American Cancer Society. They go to our Cleveland Clinic site, or any major institution usually has useful information.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.